So thank you very much for these series of presentations. Tremendous work, tremendous information, lots of information, and for staying on time. We actually, in fact, are a little bit ahead of time. So I'm going to say let's take some questions, and if people want to ask some questions right now, we'll go spend a few minutes doing that, and then we'll have a break. And there is circulating.
Hi, my name is Susan Akins. I'm working for the California Department of Public Health, and I have a question for Dr. Miller. You sort of tantalized us with saying you're not going to talk about the results in the offspring of the monkeys, but would you be willing to possibly just give us maybe one or two high-level takeaways from that aspect?
I just wanted to mention that we were doing the studies. But yes, so in the limited data that we've collected so far on the offspring, it appears that, in fact, the offspring of the females that were exposed as infants to wildfire smoke, those offspring appear to also show an immune suppression to microbial challenge or bacterial challenge in the cell culture situation, so an in vivo situation. So. Well, thank you.
Hi, David Eisenman, UCLA and Planning Committee member. Kathleen and anyone else on the committee, on the panel, Kathleen mentioned transfer of risk. And I'm just thinking about a group we haven't mentioned yet, which is prison fire workers, which is a substantial portion of the California firefighting crews, I understand it. I just know what I read in the papers, though. So you're talking about environmental exposure. We're talking about this vulnerable population that has probably little supervision about its exposure to risk and little information about that. So how should we be thinking about that in this next day or two? And can someone comment, please, on this population and what we're thinking about them in terms of justice and equity and exposure?
I think just talking about as a purely exposure piece, I can't really comment on the equity part of it, but they're exposed out on the line just like any firefighter, and they're exposed in camp. They're still going to have those risks. They're still going to be exposed, and the way that the prisoners here are in California they're used as hand crews. So they're really out on those lines, digging in the dirt, so also being exposed to silica as well.
Jackie Rezatar with NEHA. I'm interested in finding out, are you part of your own study? Is somebody going to monitor you in a couple years and compare it to the newborn monkeys and the infant monkeys? I mean, really, you seem like you've been exposed, overexposed.
I did comment during your presentation. I was like, wow, I've made some poor life decisions. But I did do some monitoring on myself for the PAH work when I was out on prescribed fires and on wildfires as well, because I'd set up monitors and then I'd go work on a fire crew.
Those of us who know Kat well and know what she does always tell her, be safe and think about your own health too.
Boy, that picture, Dr. Miller, on the right lung of the damaged, more damaged one, it looks so much like the anastomosis after some sort of terrible blockage. And I can't resist. I'm a Jersey guy. So if you come from New Jersey, you know that there are toll plazas everywhere. When Jersey and Pennsylvania got rid of the toll plazas and people drove through and they were reading the meters, birth weights went up within the perimeters around those toll plaza areas. And so, it's kind of mind-boggling that a relatively subtle exposure from a half-mile away could have this effect. So, but the question, is anybody worried about poison oak out in those fires? Especially if you're inhaling them? What do you find with all of this, Kathleen?
I've seen kind of mixed evidence that, nothing becomes aerosolized from the burning poison oak, or it is aerosolized while it's burning. I haven't had any kind of effects from it. I've only been on a few fires in California where poison oak has been an issue.
Hi, My name is Jason Bargo at the California Department of Public Health. We also hear about anywhere in the state where there's like significant soil disruption about valley fever, not West Nile virus, sorry. Have you seen that at all among firefighting crews?
I believe there have been a few cases with crews that have been working in the Central Valley and have seen cases of valley fever. And with the increase of fires, we may be seeing that more.
Yeah.
It's a fungal infection. That's my limited knowledge.
So, yeah.
Hi, I'm Colleen Ryan. I'm a surgeon, and I represent the American Burn Association. And I'm just wondering, the burn surgeons for years have been dealing with smoke inhalation injury, and in fact, wood smoke in sheep is our standard burn smoke inhalation model, which we've been working with for years, and it's a very serious, it's like the worst case scenario, wood smoke. And we know clearly that wood smoke or smoke inhalation increases mortality in patients, and we know that smoke inhalation increases infection risk in patients. And I'm just wondering what is the relationship between this chronic accumulative exposure and the information that we know of a single exposure and in our burn population? That's question one. And question two, how can you tease out the many faceted things in an event are due to smoke rather than all the other things that are happening in an event? Like, for instance, in the station fire in Rhode Island, we followed everybody that was in the building with long-term outcome questionnaires later on, and we found no difference in the incidence of post-traumatic stress disorder from people that were in that building, whether or not they were burned. And we decided that it was fear more than anything. And looking at these pictures, it looked like a very fearful event. And I imagine that this, all these shootings and these sort of things, the fear in those horrible traumatic events is possibly as eventful as the smoke. And how do you tease that sort of an interaction out?
So there's a lot there. In terms of separating out the smoke from the event itself, so in the birth outcome study that I worked on, we didn't estimate the exact exposures to PM 2.5 or any other component of the smoke. We were just comparing whether the baby gestated during the fire compared to before or after. And in our discussion of the findings, we said we couldn't say that decline in birth weight was necessarily due to the smoke or just to the fact that these mothers were living during an extreme event that could cause a lot of stress or anxiety. And that we know can also impact birth weights. And so that's possibly true for other studies as well. When you do a good job of estimating the smoke exposure, there's still some aspect of the event going on there as well. But I guess the idea being that unless you think that the level of fear or stress of the smoke event or the fire event is correlated with your estimate of the smoke exposure. If they're highly correlated, then it would be hard to disentangle that, and I don't think any studies have tried to do so. But I guess, yeah, it depends on how much you think that the fear or stress by an individual that might be affecting their physical and mental health is related to their smoke exposure would be the challenge there. And then back to the other part with the burn victims, I would say that, yeah, the evidence is that we do see some evidence in some studies that respiratory infections increases, but that's not consistent across studies. and I forget the other, and then deaths. Yes, there is evidence in the literature that there's an increase in deaths with smoke exposure associated with wildfires. But one thing I would say is that there's a recent paper that I know Anna Rappold was on, that they were comparing PM 2.5 on from wildfires compared to PM 2.5 not from wildfires, and found very similar relationships. So I think that paper did a good job of stating that it's really about the levels of air pollution exposure, and it's not necessarily, as far as we can tell so far, different based on what the source of the PM 2.5. Well, yeah, so a lot of these studies are assuming a linear dose-response relationship, and not, there aren't too many studies in the wildfire epidemiological literature that are trying to characterize the dose response that I've seen. I don't know if there's others in the audience who can speak to that more.
Hi, I'm Winston Wong with the Roundtable on Health Equity. This is a question for Heather. So I was wondering if you could elaborate a little bit more on the role of labor organizing, the role of the UFW, the role of occupational standards. Vis-a-vis, I imagine that there's some laws in place, obviously, for something like pesticide exposure. Do you foresee this creeping into the air quality exposure and or the effects of particulate matter relative to the farm worker population, and how would you think about the politics of that?
Oh, an easy question. Well, I think that the last emergency regulation that Cal OSHA enacted was the heat illness standard, and it is now well in effect. And so I think that it's fair to say that if a smoke exposure regulation is passed as on an emergency basis, I won't be surprised if it moves immediately into permanent status. I think this is really complicated because you can put shade up to block, or you can put something up to block the sun, or you can put PPE on for some pesticide exposure, but the air we breathe is the air we breathe, and California is so dependent on the harvesting of produce when it's ripe, and this is a very vulnerable population. I think the question about prisoners made me think about that. Throughout the state, cities, counties, schools were telling people to stay home. And so there's a double standard when we're then telling another population to keep working and sure, protect yourself. But I think that the protection is not clearly as effective as maybe we would like it to be. So I think there's others in the audience that might be able to speak to the potential role of Cal OSHA and other regulations that might come into play. But I know that groups like MyCop, so Genevieve's presentation this morning, groups like the CRLA Foundation, there's also industry groups. There are people catalyzing around this and trying to solve problems, and I think that I hope in a good faith effort that can move the ball forward in protecting workers. But the existing power relationships in ag, in my opinion, mean that there will be a role of regulatory bodies to ensure that all workers are safe.
And my question is for you, Dr. Navarro. I love your presentation, wonderful. But I'm wondering, like, as far as the training component, how much of your methodologic experience and kind of going out on the front lines, when you create these training programs and when you're talking to people, how do you think the way you did it can differ from folks that want to be a little more kind of 40,000-foot view trying to say this is what they need to do? Can you kind of just talk about the implementation component that comes from your experience?
Yeah, really right now the training that firefighters get really isn't till probably they're between year 5 and 10 for smoke. So, we're trying, I know that the National Wildfire Coordinating Group is trying to put stuff into, intro fire level classes right now, but it's not currently there. So the way that, I create briefings for firefighters is really just making it simple and making it tangible and trying to really get that message out that there are hazards in smoke and we need to start thinking about ways of reducing it. There is no easy answer, and I think that's the hardest part about developing these trainings is, you know, there's not a magic respirator that anybody can put on. I don't want to wear a respirator when I'm hiking at 9,000 feet carrying a 30-pound pack. So it's trying to develop ways right now to how do we reduce exposure, how do we reduce overall risk, and kind of the perspective I'm getting this summer so far is, you know, how do you make that into an everyday conversation too? How do you empower everyone to make that decision?
I think that's really important. Several of you mentioned the leadership issue. I've seen this, and we continue to see this in the military. I mean, leadership is absolutely crucial in changing the culture, and it's tough. It's very difficult to do. Being tough is what it's about, right? When you're doing, you know, working in a traumatic environment like that, and you're a rescuer. And it's not just about individual risk, it's about the collective risk. You're actually putting your team at risk if you are risking your own ability to function or not function in those areas. The military does a lot of training to demonstrate that. I'm just wondering if that is going on, maybe even in the macaques, I don't know. So I didn't hear that. I didn't hear the leadership though. So I think that's something that would love to hear, you know, in terms of ways of making that more visible in the training components. So, okay, we are right on time. So if we'll all take a break, 15 minutes, come back, we'll have our next three, and we will continue this conversation. Thank you, everyone.